Now, experts are trying to track the long COVID puzzle and understand exactly why some patients are still impacted by the virus well after their initial infection. It's estimated as many as 30% of COVID cases suffer ongoing effects, with symptoms ranging from fatigue to insomnia, anxiety, shortness of breath and brain fog.
It's feared that long COVID will add further pressure to the health system, even when acute case numbers fall and most of us are vaccinated.
One of the world's leading clinics for the treatment of long COVID is Mount Sinai Hospital in New York. And Aussie made good, Dr David Putrino joins us now as part of their groundbreaking work. David, good to have you on Sunrise. Why does long COVID affect some people and not others?
You know, that's a question that we're really looking into right now with some initial research. Right now, it seems to be related mainly to the strength of the body's immune response when you initially contract acute COVID. But what we can say at the moment is there is no telling who is going to go on to get long COVID. We have patients as young as 5 all the way through to 95 years of age, and no one appears to be necessarily safe from going on to develop long COVID symptoms.
So the body's immune response, does that have anything to do with how healthy you are at the time you contracted COVID?
No. What really has been surprising here is how many previously fit and healthy individuals went on to get long COVID. I have lost count of the number of patients that I have who tell me this isn't right. I used to run marathons. I kept in shape. None of that appears to matter. It really is a big mystery right now. It's one that we hope to have some answers for in the coming months, but right now everyone needs to be cautious.
Okay. Answer me this. I read so many times on Facebook, chat groups, people saying you can treat COVID by big doses of vitamin C and this what's it called, ivermectin. Is that true?
Yep. Look, I think your first mistake was looking on Facebook for medical advice.
Good. Good point.
No, right now the clinical data and the research that has looked into both of those interventions is inconclusive. So I would say right now, follow the experts and listen to your doctor.
Is there any way to treat it though? Or you just got to battle through?
You know, there are treatments that are effective for differing severities of COVID. So depending on how severe your initial acute infection is, we may send you to the hospital. You may get steroid infusions for the what we call cytokine storm, which is a big surge of inflammatory cells in your body as a result of exposure to the virus. And then from there, we provide supportive care for COVID pneumonia, for all of the other organ systems that are being affected for the virus. But really, it's a virus. We've got to ride it through.
So what about people who are vaccinated and people who are unvaccinated? What's the difference in the symptoms of people who get COVID?
Yeah, so right now, long COVID cases in vaccinated individuals who sustain a breakthrough infection, we're still learning a little bit about that. I can personally confirm that our clinic has seen around a dozen of these cases, so it does exist. As to the level of prevalence, we don't know yet. There have been a couple of studies that would indicate that the prevalence of long COVID following a vaccine is just as prevalent as in the unvaccinated group. However, those studies haven't had sufficient sample size for us to hang our hat on. We're leading a national trial that should give us some clarity on this in the next few months. But right now, we're learning along with everybody else.
Okay. David, that's terrific. Thanks for answering those questions for us. Really appreciate your time and good luck with the rest of the studies. Let's keep in touch.
Absolutely. Thanks for having me.
Really good.
Yeah, interesting, isn't it? Still a lot we don't know, though, isn't there? That's the trouble.
And this ivermectin victim or whatever it's called. It's all the rage at the moment. People going, oh, you should be taking that for COVID. The experts saying no. And remember, there are two forms. One is for animals as an anti-pesticide, and the Food and Drug Administration in America came out with a warning because so many people are killing themselves. They're going to vets and taking that. They get the human side.
Yeah.
So just be really careful. Follow the experts.
Yeah.